Ancient surgeons once opened a living human skull with a stone drill. Across history, healers have applied substances we would find deeply unsettling, from animal waste to powdered remains, all in the name of curing disease. This is the world of ancient medicine, a realm where methods that appear macabre to our modern eyes sometimes held a kernel of startling effectiveness. By the end of this exploration, you will understand the surprising logic behind 25 of history's most unsettling medical practices and how they actually work. We will uncover why a healer might deliberately place maggots in a wound, or how a toxic metal could be seen as a life-saving elixir. These were not acts of mere superstition, but often the result of sharp, empirical observation in an era without germ theory or modern biology. Practitioners saw a problem, like a festering injury or a debilitating pain, and through trial and error, they found solutions that delivered real, observable relief, even if the reasoning was flawed. When we say a practice worked, we mean it had a plausible biological mechanism or provided genuine symptom relief within its historical context, not that it would be safe or advisable today. It reveals a stark, pragmatic truth about our past, the relentless human drive to alleviate suffering by any means available. What would you be willing to try if it were the only hope you had? The evidence for this pragmatic, often brutal, ingenuity is written directly into human bone. Among the very oldest examples is a practice known as trepanation, the deliberate act of drilling, scraping, or cutting a hole into a living person's skull. This is not a modern concept, but an operation performed across the ancient world, from the highlands of Peru to the plains of France, with some skulls dating back over 7,000 years. The most startling fact isn't its age or its global reach, but its success. When archaeologists examine these ancient skulls, they frequently find signs of smooth, healed bone growth around the edges of the opening. This means the individual not only survived the procedure itself, but lived for months or even years afterward, their body carefully mending the remarkable window created in their head. The survival rates, by some estimates, were astonishingly high, often exceeding 80% in certain skilled cultures. This immediately shifts our perception from one of primitive butchery to one of refined, if terrifying, surgical craft. The procedure demanded an intimate knowledge of anatomy to avoid major blood vessels, a steady hand to work through the bone, and a community willing to provide extensive postoperative care, from cleaning the wound to protecting the patient during a long recovery. So why would any society repeatedly perform such a drastic operation? The proposed reasons reveal a blend of observation and belief. A severe blow to the head can cause a dangerous buildup of pressure inside the skull from bleeding or swelling. By creating an opening, ancient surgeons may have unknowingly relieved that pressure, saving a life. Similarly, chronic conditions we now understand as migraines, epilepsy, or mental distress were often interpreted as the work of trapped spirits or demons. The act of trepanation, then, was a physical release, a literal opening to let whatever was causing the torment escape. While the spiritual diagnosis was incorrect, the relief from debilitating symptoms could have been very real for the patient, making the healer's method seem validated. The macabre image of a stone drill biting into bone is forever tempered by the quiet testimony of those healed skulls, proof that even in our deepest past, the desire to heal the mind and body could lead to practices of startling and effective audacity. That same principle of observation over understanding guided healers confronting a far more visceral challenge, the festering battlefield wound. For centuries, from the Australian outback to the tents of Renaissance army surgeons, a peculiar and unsettling ally was deliberately introduced to severe injuries: the humble maggot. These fly larvae, synonymous with decay and neglect, were carefully placed into open wounds by practitioners who had noticed a consistent, if revolting, pattern. The maggots seemed to have a peculiar appetite, consuming only the blackened, dead tissue while leaving the vibrant, healthy flesh completely untouched. Without any concept of bacteria or infection, these ancient medics saw a natural cleaning agent at work, a living tool that could debride or clear away the corrupted parts of a wound that would otherwise lead to a patient's decline. The mechanism behind this macabre therapy is a masterpiece of biological precision. Once placed on the wound, the maggots secrete a powerful cocktail of digestive enzymes that specifically liquefy necrotic or dead tissue. As they feed, they also consume the harmful bacteria thriving within that dead flesh, effectively disinfecting the area. Furthermore, their movement stimulates the growth of fresh, healthy tissue and increases blood flow to the site, accelerating the body's own natural healing processes. It was a full-spectrum treatment, cleansing, disinfecting, and promoting recovery, all performed by creatures most would swat away without a second thought. This practice is so effective that it never truly disappeared. In modern hospitals, specially bred, sterile maggots are still used as a last resort for stubborn, non-healing wounds like diabetic ulcers or severe burns, particularly when antibiotics fail and surgical debridement is too risky. It stands as one of the clearest examples where ancient, seemingly grotesque observation has been validated by contemporary science, a testament to the power of watching nature's own solutions at work. But the line between a cure and a curse could be perilously thin, a truth embodied by a single, shimmering substance. For thousands of years across continents and cultures, healers were captivated by mercury. Known as quicksilver for its beautiful, liquid metal flow, it was seen as a transformational elixir, a fundamental force of nature harnessed for medicine. In ancient China, it was linked to immortality. Arabic physicians used it in salves, and in Renaissance Europe, it became the definitive, desperate treatment for a terrifying new disease, syphilis. The logic to a pre-scientific mind was compelling. Mercury is dramatically active. It kills things. When applied to the painful skin lesions and sores caused by syphilis, it did produce a visible, positive change. The sores would often dry up and recede, offering the patient a desperately wanted reprieve from their visible symptoms. This created a powerful, tragic illusion of a cure. In reality, mercury possesses strong antibacterial properties. It was inadvertently attacking the bacteria on the surface of the sores, providing temporary suppression. But the disease itself, a systemic infection, raged on inside the body. Meanwhile, the treatment initiated its own slow, catastrophic siege. Mercury is a devastating neurotoxin and kidney poison. The standard treatments involved either rubbing mercury ointments into the skin until the patient salivated excessively, a sign of poisoning, or even inhaling mercury vapors in a heated cabinet. The side effects were a horror in themselves, including severe mouth ulcers, tooth loss, kidney failure, and neurological damage leading to tremors and madness. Patients often suffered profoundly, trading one set of agonizing symptoms for another, all while believing they were being healed. So in what possible sense did this work? It worked only in the most narrow, visual, and temporary way. It provided symptomatic relief for the skin manifestations, which in an era with no other options was seen as evidence of efficacy. It gave false hope, and in doing so, it sustained a medical tradition for centuries. This makes mercury one of the most tragic entries on our list, a stark lesson in the difference between suppressing a symptom and curing a disease, and a sobering reminder of the immense human cost that could be paid when a powerful, bioactive substance was wielded in profound ignorance. The patient might feel briefly better, even as the shimmering poison quietly ensured there would be no recovery. Yet the search for balance within the body led to another creature, one whose very presence became synonymous with the healer's art for millennia. The medicinal leech, a humble aquatic worm, was not a tool of random bloodletting but a highly specialized instrument. Its use was rooted in the dominant medical theory of the ancient Western world, humoralism, which taught that health depended on a perfect equilibrium of 4 bodily fluids or humors. An excess of any one, particularly blood, was believed to cause disease, from fevers and headaches to local inflammation. The leech offered a controlled, almost elegant solution. A practitioner would apply the animal to a specific area of the patient's skin, where it would painlessly latch on and begin to feed. This was not seen as a violent act, but as a precise method of rebalancing the internal system, drawing out the corrupt or excess humor directly from the site of illness. For centuries, leeches were prescribed for a staggering array of conditions, their quiet application a common sight in sick rooms across Europe and the Middle East. So why did this practice persist for so long, and why does it warrant a place on our list of methods that worked? The answer lies not in the draining of blood itself, which was often harmful when done in large volumes by lancet, but in the sophisticated chemistry of the leech's bite. As the creature feeds, its saliva injects a powerful cocktail of over 100 bioactive compounds into the wound. The most famous of these is hirudin, a remarkably effective anticoagulant that prevents the blood from clotting, allowing the leech to feed freely. But other compounds act as vasodilators, widening blood vessels, and anti-inflammatories, directly reducing swelling. When a healer placed a leech on a painfully swollen, congested joint or a blackened eye, the animal was doing far more than just removing fluid. It was chemically improving local blood flow and easing inflammation at the cellular level. The patient would experience a genuine, tangible reduction in pressure and pain, a clear sign to both healer and sufferer that the treatment was effective. The theory of balancing humors was wrong, but the biochemical intervention was, for certain localized issues, surprisingly right. This ancient partnership has found a dramatic and respected place in the most advanced hospitals of our time. In the field of reconstructive microsurgery, where surgeons reattach severed fingers or transplant complex tissue flaps, the greatest threat to success is often venous congestion. The delicate veins, which are harder to reconnect than arteries, can become blocked, causing the reattached tissue to swell with stagnant, oxygen-poor blood and turn purple, threatening its survival. In these critical situations, surgeons will strategically apply sterile, farm-raised medicinal leeches to the tissue. The leeches relieve the dangerous pressure by removing the congested blood, and their anticoagulant saliva keeps the tiny wound bleeding freely for hours afterward, creating a temporary venous outflow that can keep the tissue alive until the body's own veins heal and take over. It is a breathtaking fusion of ancient biological wisdom and modern surgical necessity, a clear case where a macabre historical practice was not merely a curious footnote, but a prescient application of natural pharmacy that we are still learning from today. The line between poison and remedy often depended on the dosage, but for another ancient practice, the cure was hidden in what we would consider utter waste. In 4th century China, a medical text recorded a startling prescription for severe digestive distress, relentless diarrhea, and what we would now call food poisoning. The treatment was known as yellow soup, and its primary ingredient was a suspension of human fecal matter from a healthy individual, administered to the very ill patient. To the modern mind, this is instinctively revolting, a practice that seems not just unsanitary but dangerously counterintuitive, yet it was documented as an effective remedy, saving lives when other treatments failed. The ancient physicians who devised it were operating on a principle of direct observation and a concept of balance within the body. They noticed that consuming this material from someone in good health could resolve the catastrophic imbalance in someone who was suffering. They had no concept of bacteria, microbes, or ecosystems. They simply saw a transfer of health from one person to another through a most unexpected medium. The scientific mechanism, completely hidden from them, is now a frontier of modern medicine. Our digestive systems are home to a vast, complex community of microorganisms, the gut microbiome. This community is essential for breaking down food, regulating our immune system, and protecting us from harmful invaders. A severe illness, like a toxic food poisoning, can devastate this internal ecosystem, wiping out the beneficial bacteria and allowing dangerous, pathogenic ones to run rampant. This is what causes the debilitating symptoms. The ancient yellow soup worked because it was, in effect, a crude but potent microbiome transplant. By introducing the full spectrum of bacteria from a healthy donor, the healer was flooding the patient's gut with beneficial microbes. These new arrivals would outcompete the harmful pathogens for resources and space, effectively restoring balance and function from the inside out. The patient's symptoms would subside as their digestive tract recovered, a clear and dramatic recovery that validated the healer's method. This ancient, macabre insight has been resurrected in the most advanced hospitals today under the name fecal microbiota transplant, or FMT. It is now a standardized, highly effective treatment for recurrent Clostridioides difficile infections, a modern and often deadly form of severe diarrhea that can resist antibiotics. In today's procedure, carefully screened donor stool is processed and transferred via colonoscopy or capsules, not as a soup, but with the same fundamental goal: to reseed a healthy microbial garden. It stands as one of the most direct validations of an ancient practice, proving that those healers, despite their complete lack of germ theory, were not merely guessing. They were observing a profound biological truth that sometimes health itself can be contagious, transmitted in the most unexpected of ways. Yet another sweet substance from nature's pantry held a power that ancient healers recognized long before they could explain it. While honey was cherished as a food and an offering to the gods, its most vital role was often found in the healer's kit, spread thickly over the gruesome wounds of soldiers and laborers alike. From the papyrus scrolls of ancient Egypt to the battlefields where Roman legions marched, honey was a first line of defense against infection, a glistening salve applied to cuts, burns, and deep gashes. Its use feels intuitive, a natural balm, but the ancient practitioners who reached for the honey pot were unknowingly deploying one of the most sophisticated antibacterial agents available in the ancient world. This was not a simple sticky covering, it was a complex biochemical battlefield. Honey's effectiveness stems from a powerful combination of properties. First, it is intensely hygroscopic, meaning it literally pulls moisture out of its surroundings. When applied to a wound, it draws the moisture out of bacterial cells, desiccating and killing them by sheer osmotic force. Second, honey is naturally acidic, creating an environment where most harmful bacteria simply cannot thrive. But perhaps its most fascinating weapon is a slow-release mechanism. Most raw honey contains an enzyme that, when diluted with the fluids of a wound, gradually releases tiny amounts of hydrogen peroxide, the same antiseptic we use in modern first aid kits, but at a low, sustained concentration that promotes healing without damaging fragile new tissue. Finally, honey, especially varieties like Manuka, contains unique phytochemicals with direct anti-inflammatory and antioxidant effects. Together, this created a perfect storm, a sterile, moist, healing environment that protected the wound, reduced swelling, and encouraged the growth of new skin. Imagine a Roman soldier, his leg torn open by a spear, the wound hot and beginning to fester. The field medic cleans it as best he can and then packs it with honey before bandaging. That sweet, golden substance would actively fight the invisible infection, soothe the inflamed tissue, and keep the wound bed protected. It provided a barrier against new contaminants while its chemistry worked tirelessly underneath. The patient would experience less pain, less redness, and a far greater chance of recovery without the limb succumbing to gangrene. This starkly contrasts honey's gentle image as a gift from bees with its ruthless, life-saving action. It was a true pharmacy in a jar, a testament to how ancient healers, through meticulous observation, identified and harnessed the complex healing virtues hidden within the natural world, turning something as simple and sweet as honey into a frontline defense against death by infection. While honey offered a gentle chemistry, other resuscitative measures were far more direct and startling. In the bustling port cities and along the treacherous waterways of the 18th century, a drowned person pulled from the water represented a desperate race against time. Among the arsenal of revival techniques endorsed by medical societies and practiced by rescue crews was one of the most peculiar procedures in history, the tobacco smoke enema. The image is undeniably macabre, a rescuer using a bellows or a tube to forcefully blow tobacco smoke into the patient's rectum. It was an invasive, deeply uncomfortable practice born from sheer urgency and a specific, if flawed, physiological theory. The rationale hinged on two observed properties of tobacco. First, nicotine is a stimulant. It was known to increase heart rate and, crucially, to stimulate respiration, sometimes inducing coughing or deeper breaths in a user. Second, the smoke itself was warm. To the practitioners of the era, drowning represented a catastrophic cooling and slowing of the body's vital forces. The logic followed that by introducing a warm, stimulating agent directly into the body's core, they could jump-start the system, rewarming the patient and shocking the lungs and heart back into action. Specialized kits were produced, complete with tubes and bellows, and stationed along the River Thames in London, a clear indication of how seriously this method was taken by the medical establishment of its day. So where does the notion of it working come from? The method itself was dangerous, introducing risks of burns, infection, and physical trauma, and it was utterly ineffective at addressing the primary cause of death in drowning, which is a lack of oxygen. However, in a patient who was not truly deceased but in a state of profound shock or near death, the intense, invasive stimulus of the procedure, combined with the rapid absorption of nicotine through the rectal membranes, could indeed have triggered a dramatic physiological response. The nicotine, a powerful stimulant, could cause a sudden spike in heart rate and blood pressure. This might be enough to jolt a fading system, potentially causing a gasping breath or a muscular spasm that onlookers would interpret as a return to life. In those rare, dramatic instances where a patient revived shortly after the treatment, the enema would receive full credit, cementing its reputation as a life-saving technique. Its perceived success was a classic case of correlation mistaken for causation, a powerful demonstration of how the intense desire for a solution, when paired with an active substance and a plausible theory, could perpetuate a practice long after its true utility had faded. The tobacco smoke enema stands as a stark monument to medical desperation, a reminder that in the frantic moments between life and loss, even the most bizarre intervention can seem like a rational hope. The desperation to find a cleansing agent could lead to solutions found in the most mundane of places. For the citizens and soldiers of the Roman Empire, one such solution was both ubiquitous and, to our senses, profoundly unappealing. Public latrines were not just facilities for relief, they became collection points for a substance deemed valuable enough to tax human urine. Romans put this liquid to a variety of industrial uses, from tanning leather to laundering clothes, but its most intimate application was in the realm of health. It was recommended as a wound wash and, most famously, as a mouthwash for oral hygiene. The poet Catullus even mocked a man for his belief that Portuguese urine made the finest dentifrice, suggesting a regional trade in what was considered a premium product. The very idea is instinctively repulsive, Yet within the context of a world without antiseptics, it carried a grim, pragmatic logic. What the Romans could not have known is that they were harnessing a simple chemical reaction. When urine is left to stale, the urea within it begins to break down into ammonia. Ammonia is a base with mild antiseptic and cleansing properties, capable of breaking down organic matter and creating an environment less hospitable to some bacteria. For a soldier rinsing a dirty gash with what was available, or an individual swishing it in their mouth, the ammonia provided a genuine, if modest, cleaning action. It could help flush debris from a wound and might temporarily reduce oral bacteria, combating bad breath and possibly even slowing tooth decay in an era before modern dentistry. The relief from pain or the improved smell of one's breath would have been immediate, tangible evidence that the practice worked. This underscores a recurring theme in ancient medicine, the use of observable cause and effect. They saw a substance that cleaned cloth and softened hides, and they reasoned it could clean tissue as well. While the risk of introducing other pathogens was high, and the practice is rightly abandoned, it stands as a testament to the human drive to utilize every available resource in the fight against decay and disease, turning even the body's own waste into a tool for preservation. This drive to find healing in the most unexpected of substances took a profoundly darker turn centuries later, not in a battlefield tent or a healer's hut, but in the silent tombs of Egypt. By the Middle Ages and flourishing through the Renaissance, a strange and morbid commodity became one of Europe's most sought-after medicines, mummy powder. Apothecaries stocked it, royalty demanded it, and physicians prescribed it for a staggering list of ailments, from persistent headaches and stomach troubles to bruising and internal bleeding. This was not a metaphorical name, but a literal one. The medicine was made by grinding up the desiccated remains of ancient Egyptian individuals, often those pulled from their sacred resting places and shipped across the Mediterranean in fragments. To our modern understanding, this practice sits at a disturbing crossroads, combining grave robbery with an act of literal cannibalism, all sanctioned by the medical orthodoxy of its day. The logic, however twisted it seems now, was rooted in a powerful misconception. The word mummy itself comes from the Persian mumia, which referred to bitumen, a natural, tar-like asphalt that was prized for its supposed medicinal properties. When European traders encountered the dark, resin-coated bodies from Egyptian tombs, they mistakenly believed they were seeing bodies preserved in this healing bitumen. Therefore, consuming the powder was thought to transfer the potent, preserving life force of the mumia directly into the sick patient. It was the ultimate transference therapy, an attempt to ingest durability and longevity itself. For a patient suffering from a wasting illness or a wound that would not heal, the psychological impact of receiving such a rare, expensive, and mystically charged treatment could be immense. The placebo effect, fueled by profound belief in the physician and the exotic origin of the cure, likely accounts for any reports of improved well-being or eased symptoms. There is, however, a fringe but fascinating scientific footnote that adds a macabre layer of potential truth. The linen wrappings and the organic materials within the tombs would have been a perfect environment for ancient strains of mold, particularly penicillium. Ingesting powder contaminated with these molds could, in theory, have delivered a minute accidental dose of natural antibiotics to a patient with a bacterial infection. This would have been a completely random and unreliable effect, but in a handful of cases, it might have contributed to a genuine, if unexplained, recovery, further cementing the powder's legendary status. The trade in mummy remains became so rampant that it spawned a grisly industry of forgeries, with contemporary bodies sometimes being passed off as ancient ones to meet the insatiable demand. This chapter stands as one of the most unsettling examples of how far the pursuit of health could stray, where reverence for the past was consumed literally in the hope of a future, transforming sacred memorials into a macabre and widely accepted pantry for the pharmacy of the age. Perhaps the most poignant intersection of life, loss, and medical intervention occurred in the quiet aftermath of a tragedy. Across the ancient world, from Rome to China, a desperate and solemn procedure was sometimes performed, one codified in Roman law as the lex caesarea. This law stipulated that if a woman died late in her pregnancy or during childbirth, an attempt must be made to cut the living child from her womb before burial. This was not the caesarean section as we know it today, performed under anesthesia to save both mother and child. This was a post-mortem operation, a final, urgent act to rescue a new life from the grip of a profound loss. The image is undeniably heavy, a procedure born from utter necessity in an era where maternal mortality was a common and devastating reality. Its macabre nature is inseparable from its fundamental purpose, to salvage hope from tragedy. In this most direct and heartbreaking sense, the procedure worked. It was a tragically effective surgical intervention for fetal survival when the mother could no longer be saved. By opening the womb quickly after the mother's passing, a midwife or healer could, in some cases, deliver a baby that might still be alive, granting it a chance at life it would not otherwise have had. The success of such an operation would have been a bittersweet miracle, a new life entering the world amid profound grief, forever linking the child's survival to the parent's sacrifice. This ancient practice stands in stark contrast to the modern caesarean section, a planned and sterile procedure designed with the safety of both patients in mind. The historical post-mortem section was an act of last resort, a raw application of anatomical knowledge in the face of inevitable loss, demonstrating that even in the darkest moments, the drive to preserve life could manifest in ways that were both unsettling and, within their tragic context, undeniably effective. The drive to seal a wound and stop the relentless flow of blood led to one of the most direct and harrowing methods in the ancient healer's arsenal. When a soldier fell with a deep gash or an amputation was necessary, the immediate threat was not just pain but fatal hemorrhage and the infection that would surely follow. In these critical moments, surgeons like the Greek physician Archigenes, practicing in Rome around the turn of the 2nd century, reached for a substance more commonly associated with sealing ships than saving lives: heated tar or pine pitch. The procedure was as straightforward as it was brutal. The thick, dark resin would be heated until it became a viscous liquid, and then, with steady precision, it was poured directly into the open wound. The searing heat would instantly cauterize the severed blood vessels, sealing them shut with a sizzling hiss. This act alone, though agonizing, was a life-saving intervention, turning a fatal bleed into a controlled, if traumatic, closure. But the pitch did far more than just burn. As it cooled and hardened inside the wound cavity, it performed a triple function of remarkable ingenuity. First, the initial intense heat provided a crude form of sterilization, killing bacteria on the surface of the injury. Second, the cauterization physically sealed the ends of blood vessels, staunching the flow. Third, and perhaps most importantly, the hardening pitch formed a perfect, airtight synthetic scab. This rigid seal acted as a barrier impenetrable to dirt, flies, and airborne contaminants, creating a sterile environment underneath where the body could begin its slow work of healing without the constant threat of invasion. It was a primitive but effective form of battlefield triage, prioritizing survival over comfort. This same adhesive, sealing property found another groundbreaking application in the ancient world: prosthetics. The most famous example is the Roman Capua leg, a wooden and bronze artificial limb dating back to around 300 BCE. For such a device to be functional, it needed a secure and comfortable connection to the living tissue of the amputee's residual limb. Historians and engineers studying the design believe a socket was likely lined with a soft material, perhaps leather, but then sealed and attached using pliable pine pitch or beeswax. This adhesive would have created a custom mold, cushioning the sensitive stump while also forming a waterproof seal that protected the vulnerable amputation site from infection. The tar or pitch essentially glued the world of the living body to the world of the crafted object, allowing an individual to walk again. In both cases, for the gaping wound and the missing limb, this dark, sticky substance served as a mediator between the fragile human form and a harsh, unforgiving world. It was a stark, pragmatic solution that traded moments of extreme hardship for the profound gift of continued life and mobility, a testament to the ancient healer's willingness to use whatever harsh tool nature provided to rebuild and protect the body. From the hardened seal of pine pitch to the contents of a stable, ancient healers were willing to consider every substance nature offered. Among the most challenging for us to comprehend are the recipes calling for a most unappealing ingredient, animal dung. Papyrus texts from ancient Egypt and records from other early cultures describe poultices made from the feces of dogs, crocodiles, and even mice, applied directly to open wounds, burns, or skin lesions. At first glance, this seems like the absolute antithesis of healing, a practice guaranteed to introduce a catastrophic infection, and for the vast majority of patients, that was likely the tragic outcome. Smearing decomposing organic matter into a break in the skin is an open invitation for a host of dangerous pathogens, turning a simple injury into a life-threatening crisis. The risk was immense, a dangerous gamble with a patient's well-being. Yet the very fact that such treatments were recorded and persisted suggests that on rare, bewildering occasions, they did not lead to disaster and may have even seemed to help. This forces a difficult question: how could something so inherently risky ever yield a positive result? The answer lies not in the dung itself, but in the invisible world it harbored. The digestive systems of animals, particularly herbivores, are complex ecosystems teeming with bacteria. While most of these microbes are harmful if introduced into a human wound, a few are surprisingly beneficial. Modern research has identified that certain animal droppings, especially from species like the wild boar or some herbivores, can contain strains of Bacillus subtilis. This is a remarkable bacterium because it is a prolific producer of natural antibiotics. When it senses competition from other microbes, it secretes chemical compounds specifically designed to inhibit or kill rival bacteria, essentially waging a microscopic war for resources. In the chaotic, unseen event that a healer applied dung rich in these specific, antibiotic-producing bacilli to a wound, an incredible and accidental scenario could unfold. The beneficial bacteria would immediately begin fighting the more dangerous pathogens already present or those introduced by the dung itself. They would act as a living microbial shield, suppressing infection long enough for the body's own defenses to gain a foothold. The wound might show less redness, less swelling, and begin to heal more cleanly than expected. To the healer and the patient, this would be a clear sign of the treatment's efficacy, a validation of their methods written in the patient's own recovering flesh. It was a matter of sheer blind luck, a random draw from nature's vast and mostly dangerous microbial library that occasionally, by chance, yielded a winning ticket. This practice stands as one of the starkest examples of ancient medicine's high-stakes experimentation, where the line between a lethal poison and a life-saving cure was drawn by microscopic combatants completely invisible to the human eye. It was not wisdom, but a desperate, observational science playing with forces it could not see, where success was as terrifying as failure. The pursuit of beauty and relief could wear a deceptively lovely face, one painted with a brilliant, lasting white. In the bustling forums and villas of ancient Rome, both women and men of status sought a pale, flawless complexion, a sign of leisure and refinement that stood apart from the weathered skin of laborers. To achieve this ideal, they turned to a cosmetic known as cerus, a mixture of white lead and vinegar that created a smooth, opaque paste. Applied daily, it covered blemishes and created a fashionable porcelain mask, while other lead-based compounds like red lead were used as blushes. This was not a fringe practice, but a mainstream standard of elegance, endorsed by the most celebrated figures of the era. But the reach of lead extended far beyond the vanity table and into the physician's kit. A substance called sugar of lead or lead acetate was a common prescription. This sweet-tasting compound, formed by dissolving lead in vinegar, was administered as a treatment for persistent diarrhea and used in salves for open skin ulcers. On the surface, this seems like a catastrophic contradiction, applying a known poison to broken skin and ingesting it for internal distress. Yet from the perspective of a Roman healer, the logic was clear and the results were visibly convincing. Lead compounds possess strong astringent properties, meaning they cause body tissues to contract and tighten. When a salve containing sugar of lead was smoothed over a weeping ulcer, it would quickly dry the wound's surface, forming a neat, dry scab. For a patient suffering from a messy, painful sore, this rapid drying provided immediate and welcome relief. Similarly, when ingested, the lead would act upon the lining of the intestines, slowing their muscular contractions and reducing fluid secretion. For someone debilitated by relentless diarrhea, this slowing of the digestive tract would bring a sudden, dramatic halt to their most distressing symptom. In both cases, the patient experienced tangible, fast improvement. The healer saw a treatment that produced observable, positive change, validating its use for generations. The catastrophic flaw, completely invisible to them, was the long-term price of that short-term relief. Lead is a potent neurotoxin that accumulates silently in the body, attacking the nervous system, causing anemia, severe abdominal pain, gout, and cognitive decline marked by irritability and memory loss. The very paleness sought through cerus was often a precursor to the pallor of chronic poisoning. A Roman aristocrat might admire their flawless white complexion in a polished bronze mirror, unaware that the source of their beauty was also slowly stealing their health, their mood, and their clarity of thought. The perceived effectiveness was a cruel illusion, a temporary suppression of a symptom that came with a lifelong, degenerative sentence. This chapter reveals a haunting pattern in ancient medicine, where the urgency for a visible solution could blind practitioners to the slow, systemic cost, turning daily rituals of beauty and moments of relief into pathways for a slow, insidious decline. The search for internal healing required tools of equal precision and intrusion. Among the artifacts preserved in the ashes of Pompeii is a device that would be instantly recognizable to any modern gynecologist, a vaginal speculum. Crafted from bronze, its design features 2 or 3 smooth blades that could be separated by a central screw mechanism, gently but firmly holding the vaginal walls apart. This was not a medieval curiosity, but a well-documented instrument in the texts of Greco-Roman physicians like Soranus of Ephesus, who practiced in the 2nd century. Its existence speaks to a dedicated branch of women's medicine in the ancient world, one that sought to move beyond guesswork. Yet the use of such a tool in an era without anesthesia or modern concepts of patient privacy represented a profound and deeply personal hardship. Examinations and treatments were undoubtedly uncomfortable and invasive, a physical and social vulnerability placed in the hands of the healer. The clinical effectiveness of the device, however, was undeniable. For the first time in recorded Western medicine, it allowed for direct visualization and access to the cervix and vaginal walls. This was a revolutionary shift from blind manipulation or external observation alone. A physician could now accurately diagnose conditions like uterine prolapse, where the organ descends from its normal position. More dramatically, it enabled precise surgical interventions, such as the removal of painful polyps or growths, procedures that could provide genuine relief from chronic conditions. The speculum transformed gynecological care from a realm of speculation into one of observation and targeted action. It stands as a sobering symbol of ancient medical practice, a tool that delivered tangible clinical benefit through a channel of profound personal exposure, highlighting the complex trade-offs between advancement and individual comfort in the relentless pursuit of understanding the human body. The speculum allowed for delicate internal work, but some wounds demanded a far more direct and fiery confrontation. When a limb was shattered beyond repair or a deep gash refused to close, the healer's final, desperate tool was not a delicate blade but a rod of iron glowing in the coals. The practice of cauterization, searing flesh with a red-hot metal, was a universal and agonizing last resort across ancient and medieval battlefields and sick rooms. The procedure was as straightforward as it was harrowing. The patient, often held down by strong assistants, would be given a leather strap to bite or a draught of strong wine, but little more. The surgeon would then take the heated iron, its tip a brilliant cherry red, and press it firmly into the open wound or against the stump of an amputation. The sound and smell were unforgettable, a hiss of steam and the scent of burning tissue, as the metal literally cooked the exposed flesh, sealing it shut under a layer of blackened, charred skin. The pain was unimaginable, a white-hot agony that represented the very threshold of what a human being could be asked to endure. Yet this extreme hardship was not an act of cruelty, but one of grim, calculated necessity. In an era before sterile sutures and reliable tourniquets, the greatest immediate threat from a severe injury was exsanguination, bleeding to death. Cauterization worked because it was the most reliable method of hemostasis available. The intense heat instantly fused the ends of severed blood vessels, melting them closed in a process called coagulation. This transformed a life-threatening arterial spray into a sealed, if traumatized, endpoint. But the benefits went beyond simply stopping the flow. The same searing heat that sealed the vessels also performed a crude but effective sterilization. By burning away the contaminated flesh at the surface of the wound, the tissue most exposed to dirt, rust, and bacteria, the cautery iron created a fresh, scorched layer. This burned surface was initially sterile, forming a protective barrier that drastically reduced the risk of the gangrene and putrid infection that killed more soldiers than the initial blade or bullet. For the patient, surviving the fire meant a chance, however difficult, at a future. The alternative was almost certain death from blood loss or a slow, feverish decline from infection. The cautery iron, therefore, stands as one of the most stark symbols of ancient surgical pragmatism. It traded moments of extreme, focused suffering for the profound possibility of continued life, a brutal equation where the healer applied the worst pain imaginable to avert an even greater final silence. While the cautery iron fought fire with fire, other ancient remedies sought to outwit a more insidious threat, poison. In the treacherous courts of kings and emperors, where a single meal could be a final one, the fear of assassination by toxin was a constant, chilling reality. This pervasive dread fueled the pursuit of the ultimate protective charm, a universal antidote. The most legendary of these was Mithridatium, named for King Mithridates VI of Pontus, a ruler so obsessed with poison that he reportedly consumed sublethal doses daily to build an immunity. His personal recipe, later expanded upon by Roman physicians like Nero's Dr. Andromachus, evolved into an even more famous compound known as theriac. This was not a simple herbal tea but a monumental concoction. Recipes called for dozens, sometimes over 70, ingredients, meticulously prepared and left to mature for years. The list reads like a fantastical grocer's nightmare, including everything from cinnamon and saffron to the roasted flesh of vipers, the bile of a wild boar, and powdered precious stones. It was a physical embodiment of the principle that complexity itself could confer power, a blend of the exotic, the expensive, and the utterly bizarre, all fermented into a thick, syrup-like paste known as treacle. To the modern mind, it seems like the pinnacle of superstitious alchemy, a magical cure all with no rational basis, and for the most part it was. Yet, in the tangled web of its ingredients lay a few threads of genuine, if accidental, biological activity. When a patient took theriac for a mysterious illness or in a panic after a suspected poisoning, several things could happen that would convincingly suggest a cure. First and most significantly, many recipes contained opium. This powerful narcotic would have provided immediate and profound relief from pain, calming the patient's distress and allowing them to rest. For someone suffering from a painful ailment, this alone would feel like a miracle. Second, spices like cinnamon, ginger, and saffron possess mild antimicrobial and anti-inflammatory properties. While not strong enough to combat a serious infection, they could soothe an upset stomach or a sore throat, easing symptoms. Third, and most directly relevant to poisoning, some of the animal-based ingredients or the sheer overwhelming nature of the concoction could induce vigorous vomiting. If a toxic substance had recently been ingested, this physical expulsion could literally save a life by purging the stomach before the poison was fully absorbed. The physician would see a patient in crisis ingest the theriac, become violently ill, and then gradually recover, their symptoms alleviated by the opium and spices. The conclusion was obvious. The magnificent, complex antidote had drawn out the evil and restored balance. Its reputation as a panacea, a cure for everything from plague to melancholy, was cemented not by its design, but by this chaotic interplay of placebo, physiological side effect, and the rare instance of genuine mechanistic luck. For over a millennium, from ancient Rome through the Middle Ages and into the Renaissance, theriac remained a cornerstone of official pharmacy, its very complexity a testament to humanity's deep desire for a single, sovereign shield against all the invisible dangers the world could conjure. The pursuit of relief from poison was a matter of courtly intrigue, but another form of agony was a far more common and democratic torment. For countless individuals throughout history, a specific, grinding pain could become the central fact of existence, a misery caused by a small, hard object forming silently within the body. Bladder stones, crystallized deposits of minerals, could grow for years, eventually blocking the flow of urine and causing excruciating spasms, infections, and a slow, painful decline. When herbal remedies and prayers failed, there remained one terrifying, definitive solution: a surgery known as lithotomy, or cutting for the stone. This was not a procedure of last resort in a modern sense. It was the only resort for a condition that was itself a death sentence. For over 2,000 years, from the descriptions in the Hippocratic texts to the barber surgeons of the 18th century, this operation was performed, a brutal testament to the lengths humans would go to end unbearable suffering. The most common method was the perineal lithotomy. The patient, often held down on a table, would be given alcohol or opium, but nothing that could truly blunt the reality of what came next. The surgeon would insert a metal sound into the urethra to locate the stone and guide it down. Then, with a swift, deep incision into the perineum, the area between the scrotum and the anus, he would cut through layers of muscle and tissue directly into the bladder. A finger or a pair of specialized forceps would be inserted into this fresh wound to find and grasp the stone, which was then extracted through the incision. The entire procedure, from first cut to extraction, was often completed in under a minute, a frantic race against time, shock, and blood loss. The aftermath was its own kind of horror. The risks of catastrophic bleeding, devastating infection, and permanent incontinence or fistulas were staggeringly high. Mortality rates from the operation itself or the sepsis that followed could reach 50% or more in some eras, a grim gamble where the coin toss was between a torturous death from the stone or a probable death from the cure. So how can such a harrowing practice be considered effective? its effectiveness lies in a stark binary truth. For the specific, life-threatening condition of a large bladder stone, lithotomy was for centuries the only known definitive cure. When it succeeded, the results were immediate and transformative. The blockage was physically removed. The relentless pressure and agonizing spasms ceased almost the moment the stone was pulled free. A patient who survived the ordeal would wake from their fevered pain to a profound and liberating relief, their body finally able to function normally again. This tangible, life-restoring outcome is what compelled surgeons to refine the technique across generations. Figures like Ammonius Lithotomos in 3rd century BCE Alexandria earned his surname by developing tools to better grasp and crush stones within the bladder, making extraction easier and slightly less traumatic. These incremental improvements, born of gruesome experience, slowly pushed survival rates upward. The operation's legacy is therefore one of brutal necessity. It was not good medicine by our standards, but it was, for its time, effective medicine. It traded minutes of unimaginable intervention for decades of potential life without pain, a desperate equation that thousands chose to accept, placing their faith in a surgeon's speed and skill over the certainty of a slow, grinding end. This chapter stands as perhaps the purest example of ancient medicine's core dilemma, where the cure could be as dangerous as the disease, yet the possibility of life after the knife was a light powerful enough to lead patients through the deepest darkness. But the search for pain relief did not always require a blade. Sometimes the cure was found not in a healer's hands, but in the shallows of the Mediterranean Sea. Ancient Greek and Roman physicians, including the famed Galen, prescribed a living, breathing treatment for ailments like persistent gout and debilitating headaches, the torpedo fish. This was not a metaphorical remedy. Patients suffering from joint pain were instructed to stand upon a live electric ray as it rested in the wet sand. For a headache, the fish might be held directly against the patient's forehead. The experience was undoubtedly strange, a slippery, living compress, yet the moment of contact delivered a genuine, startling jolt. The torpedo fish and similar electric catfish from the Nile possess specialized organs capable of generating a substantial electric discharge, a biological defense mechanism they wield with precision. To the patient enduring this therapy, the sensation was immediate and profound, a sharp, tingling shock that coursed through the affected area. This was not mere superstition. It was an accidental but brilliant application of electrotherapy. The electric discharge served two crucial functions. First, it acted as a powerful counter-irritant. The sudden, intense neural signal from the shock would overwhelm and temporarily scramble the pain signals traveling from the gout-ridden joint or the throbbing head to the brain. This provided a genuine, if temporary, numbing effect, a respite from chronic agony. Second, the electrical pulses could cause involuntary muscle contractions around the joint, stimulating blood flow and potentially reducing local inflammation. In essence, these ancient practitioners were employing a primitive, organic form of what we now call transcutaneous electrical nerve stimulation, or TENS therapy, a common modern treatment that uses low-voltage electrical currents for pain management. The patient, feeling the pain subside after the strange encounter, would have had tangible proof of the treatment's worth. It was a clear case of observing a powerful natural phenomenon and harnessing its side effects for human benefit. The healer did not understand bioelectricity, but they understood cause and effect. They saw a creature that could deliver a shock capable of numbing a limb, and they logically applied that shock to a limb that was already in torment. This practice transforms the electric fish from a simple curiosity into one of history's most ingenious biological tools, a living battery deployed in the silent war against pain, proving that sometimes the most advanced technology available was simply another creature, perfectly adapted and waiting in the tide. The human skull, a vessel for thought and identity, has also been a canvas for cultural expression. In societies as diverse as the ancient Maya, the Huns, and certain tribes of Europe and Oceania, a remarkable practice was performed not on the sick but on the healthy newborn. Within days of birth, an infant's soft, pliable head would be gently bound between padded boards or wrapped tightly with cloth, applying steady, careful pressure over many months. This intentional cranial deformation created a permanent, dramatic elongation of the skull, a striking silhouette that set the individual apart from birth. Primary purpose was not medical but social and aesthetic. A distinctively shaped head was a mark of nobility, a signifier of belonging to a specific group or an elite class, a living symbol of cultural identity molded literally from infancy. The practice worked perfectly to achieve this social goal, transforming the body itself into a statement of status and lineage. Yet beyond the cultural meaning, some proponents of the practice wove in a layer of perceived medical rationale. There were beliefs passed down through generations that this altered shape could confer practical benefits. Some thought an elongated skull might prevent certain childhood illnesses, or that the reshaped cranium could allow for greater brain capacity, leading to enhanced intelligence or spiritual acuity. From our modern understanding, these specific health claims are not supported. The procedure, when performed with care, did not typically crush or damage the developing brain, which simply grew to fill the available, albeit unusually shaped, space. Cognitive function was not inherently impaired by the deformation itself. In this delicate sense, the practice worked because it achieved its intended cultural outcome, a permanent bodily modification signifying status, without generally causing the infant's death or severe neurological harm. It represents a profound intersection of the physical and the social, where the malleable human form was gently guided into a shape deemed beautiful, powerful, and proper, a silent testament written in bone to the values of a community long gone. The living battery of the electric ray offered a tangible shock, but another cure was believed to reside in a far more permanent source. Across Renaissance and early modern Europe, a macabre pharmacy extended far beyond powdered mummy. Apothecary shelves stocked moss scraped from the skulls of criminals left on gibbets, a substance called usnea, believed to cure epilepsy and nosebleeds. Human fat, rendered from executed bodies, was an ingredient in salves for aching joints. Perhaps most startling, fresh blood from a dying person was sometimes collected and drunk by those suffering from epilepsy or consumption, in the belief it could transfer the fleeing vitality of the deceased into the weak. This widespread practice, known as corpse medicine, seems a pinnacle of the grotesque, yet it operated within a coherent, if deeply flawed, worldview. It was rooted in the ancient doctrine of sympathies, which held that invisible connections linked all things in nature. A part could influence the whole, and the qualities of one substance could be transferred to another. The skull, as the seat of reason, might impart strength to a faltering mind. The blood, the very liquid of life, could reinvigorate a wasting body. It was a literal, physical form of sympathetic magic, where consuming an essence was believed to absorb its power. For conditions with a strong psychological or psychosomatic component, like certain forms of epilepsy or the profound weakness of tuberculosis, the very extremity of the ritual could have a profound impact. The belief that one was ingesting a powerful, forbidden cure procured at great cost and moral unease generated an immense placebo effect. The patient's conviction in the treatment could reduce stress, improve their perceived well-being, and in some cases, perhaps even catalyze the body's own capacity for recovery, a self-fulfilling prophecy born of profound faith in the cure's potency. This same belief in transferred authority reached its zenith not in a dark apothecary, but in the glittering light of court. For centuries, English and French monarchs performed the royal touch, ceremonially laying hands on subjects afflicted with scrofula, a tubercular infection of the lymph nodes in the neck often called the king's evil. The ceremony was solemn and lavish, a direct channel of divine grace flowing from God through the anointed sovereign. The king would touch the sores, sometimes hang a gold coin around the patient's neck, and offer a blessing. From a modern medical standpoint, scrofula can sometimes resolve on its own or enter periods of remission. The miraculous cures attributed to the royal touch almost certainly stemmed from this natural course, combined with an unparalleled psychological intervention. For a common person, the journey to court, the awe-inspiring presence of the monarch, the sacred ritual, and the tangible gold token created an experience of overwhelming hope and significance. This drastic shift in a patient's mental and emotional state, the belief they had been personally chosen for healing by God's representative on earth, could powerfully influence their perception of pain and their body's stress responses. It was the ultimate placebo, administered with full royal authority. Both corpse medicine and the royal touch reveal a world where the mind's influence over the body was the unacknowledged healer. The cure was not in the moss or the touch itself, but in the staggering, transformative power of belief, a force that could turn a dreadful substance or a majestic gesture into a catalyst for the body's own latent capacity to mend. A glimmering metal prized for its beauty and value held a secret power long before its science was known. From the courts of Macedonian kings to the tents of field surgeons, silver was not merely wealth, it was a practical tool for health. Ancient rulers like Alexander the Great reportedly stored their drinking water in silver vessels during long campaigns, a practice born from simple observation. Water kept in these containers seemed to stay fresher, clearer, and free from the foul smells that plagued water stored in clay or leather. Similarly, healers across cultures learned to place thin sheets of silver foil over serious burns or deep wounds. They noticed that injuries dressed with this precious metal were less likely to fester, to swell with angry redness, or to smell of decay. The patient experienced less pain and a cleaner, quicker recovery. To the ancient healer, this was a clear sign. Silver possessed a quiet, preserving virtue, a cool purity that could somehow ward off the invisible forces of corruption. They called it by many names and attributed it to celestial influences, but the effect was tangible and repeatable. The hidden mechanism, completely invisible to them, is a phenomenon modern science calls the oligodynamic effect. Silver, even in tiny, trace amounts, releases positively charged ions. These ions are lethally attractive to bacteria. The silver ions bind to the bacterial cell wall, punching microscopic holes in its protective membrane. Once inside, they wreak havoc, disrupting the cell's ability to breathe and replicate by binding to essential proteins and enzymes. It is a silent, electrochemical siege that halts an infection in its tracks. This made silver foil one of the earliest and most effective broad-spectrum antiseptic dressings in history. The healer saw a clean wound and credited the metal's noble nature. In truth, they were deploying an army of ions on a scale they could not conceive, a genuine antimicrobial agent that worked through simple chemistry. This ancient insight never faded. Before the age of modern antibiotics, new parents would place a silver coin in a baby's milk to keep it from spoiling. During the World Wars, soldiers would sprinkle silver dust into their canteens to purify questionable water. Today, we see its legacy in specialized burn dressings impregnated with silver sulfadiazine and in the silver-coated surfaces of hospital equipment designed to resist bacterial growth. It is a direct thread connecting a king's ornate water jug to the most advanced infection control, a story where a metal's lustrous beauty was merely the visible sign of its far more valuable and invisible power to guard life itself. The cool purity of silver fought infection, but another plant offered a far more treacherous kind of relief, one that could blur the line between sleep and a permanent silence. In the shadowy corners of ancient herb gardens grew a deceptively beautiful plant with dark, glossy berries, known as deadly nightshade or belladonna. Its very name whispers a dual nature, belladonna meaning beautiful lady in Italian, and atropa for the fate who cut the thread of life. This was not a remedy for the faint of heart. Ancient surgeons and midwives, however, understood that within its lethal leaves and berries lay a power worth the peril. They employed it in two seemingly opposite ways, for deep unconsciousness and for heightened allure. Before a bone setting or an amputation, a healer might prepare a soporific sponge, soaked in a brew containing belladonna, opium, and other herbs. This sponge would be held over the patient's nose and mouth, its fumes inducing a profound twilight sleep. The patient would not feel the cut of the blade, a mercy beyond measure in an age without true anesthesia. Separately, women of Renaissance Italy learned that a tiny drop of belladonna juice placed in the eye would cause the pupil to widen dramatically, creating a dark, luminous gaze considered intensely attractive. This practice of using poison for beauty is where the plant earned its beautiful lady moniker. The terrifying effectiveness of both uses stems from the plant's active alkaloids, chiefly atropine and scopolamine. In the minuscule, carefully measured doses a skilled practitioner might achieve, these compounds are potent antispasmodics and sedatives. They can relax muscles, dry secretions, and depress the central nervous system, creating the state of suspended animation surgeons sought. The same compounds, when applied to the eye, paralyze the muscles that constrict the pupil, forcing it to dilate. The line between a therapeutic dose and a fatal one, however, was vanishingly thin. There was no standardization. The potency of the plant varied with the soil, the season, and the preparation. A miscalculation by a single drop could tip a patient from a healing sleep into a coma, or from a wide-eyed gaze into blurred vision, racing heart, and fatal respiratory failure. It was medicine as a high-stakes negotiation with death, a demonstration that ancient healers were willing to harness the most volatile forces in nature to achieve their ends. The patient's relief or enhanced beauty was the prize, but the cost of error was absolute, making belladonna a perfect symbol of the razor's edge our ancestors walked in their quest to master the body's pains and desires. The precision required to navigate the delicate architecture of the nose suggests an anatomical knowledge that feels almost impossibly advanced. Among the most startling evidence comes from ancient Egypt, where medical papyri and physical examination of mummies hint at a procedure of chilling sophistication. There are indications that some healers learned to access the deepest part of the cranial cavity, not by opening the top of the skull, but by going through it using a pathway that began in the darkness of the nasal passages. This route, known today as transsphenoidal surgery, involved the careful maneuvering of instruments up through the nose or the back of the throat to reach the sphenoid bone at the very center of the skull's base. The objective remains a subject of scholarly interpretation. It may have been an attempt to address what we now understand as pituitary tumors, growths that can cause dramatic changes in vision, headaches, and bodily function. Alternatively, given the era's challenges with parasites, it could have been a method to extract creatures that had migrated to that vulnerable area. The procedure itself, as we can reconstruct it, was a masterclass in minimal access. A healer would have used a long, slender tool, perhaps made of bronze or reed, to gently displace the soft tissues of the nasal cavity. With meticulous care, they would then navigate through a natural opening in the sphenoid bone, known as the sella turcica, which cradles the pituitary gland. This approach avoided the immense trauma and risk of a full craniotomy, bypassing the major blood vessels and the bulk of the brain itself to reach a precise target. Its macabre brilliance lies in this very efficiency. It recognized that the most direct path to a central problem is not always the most obvious one, that sometimes you must travel through one part of the body to heal another. This ancient principle is not a forgotten curiosity. It is the cornerstone of a standard modern neurosurgical operation. Today, surgeons performing an endoscopic transsphenoidal surgery for a pituitary adenoma follow an almost identical philosophical and anatomical roadmap. Using a tiny camera and micro-instruments passed through the nostril, they navigate the same nasal corridor, penetrate the same bony window, and remove tumors from the same delicate gland, all without a single external incision. The ancient healer, working without magnification or modern lighting, was attempting a feat of breathtaking audacity. They sought to alter the very command center of the body's hormones through a passageway used for breath, a concept that merges the realms of the mundane and the miraculous. It stands as a profound testament to the power of observation and deductive reasoning, where the solution to a profound internal mystery was found not in a grand opening, but in a carefully chosen hidden door. The natural world was a vast, untested pharmacy, and ancient healers left no stone or reptile unturned in their search for cures. Among the more peculiar entries in this biological catalogue were remedies derived from creatures that scurried and crawled. In ancient Rome, physicians like Galen recorded the use of lizard blood, specifically from a type of skink, as a treatment for diseases of the eye. The preparation was direct and unsettling, the blood of the animal being mixed into a solution and applied directly to the patient's irritated or infected eyes. Meanwhile, in the traditions of Chinese medicine, dried geckos were ground into a paste and used to treat stubborn skin conditions, from persistent rashes to lesions that refused to heal. On the surface, these practices seem rooted purely in sympathetic magic or superstition. The lizard, with its unblinking, keen eyes, was thought to transfer its visual prowess. The gecko, capable of regenerating its lost tail and shedding its skin, was seen as a symbol of renewal for damaged human tissue. The logic was symbolic, not scientific, a classic case of the doctrine of signatures where an animal's appearance or behavior hinted at its medicinal purpose. For the patient, the very strangeness of the cure could be powerful. Applying the blood of a swift, sharp-eyed creature to one's own failing vision, or a paste made from a regenerative lizard to a wound, carried immense psychological weight. This profound belief in the treatment's exotic potency could trigger a significant placebo response, easing the patient's distress and perhaps allowing the body's natural healing processes to proceed with less interference. Yet, modern research adds a fascinating, speculative layer to this ancient trial and error. Scientists have discovered that some species of lizards and geckos produce skin secretions rich in antimicrobial peptides, natural compounds that act as broad-spectrum antibiotics to protect the animal from infection in its environment. If by chance the particular species used in these ancient remedies possessed such peptides, and if they survived the preparation process, they could have introduced a genuine, if weak, antibacterial agent to an infected eye or an open sore. The healing that followed would then be a fortunate accident, a random hit in a millennia-long experiment of testing every substance nature provided. These lizard blood and gecko paste treatments stand as perfect examples of the endless, often desperate, experimentation that characterized ancient medicine. They represent a search through the dark with only the faintest glimmers of symbolic logic to guide the way, where success, when it rarely came, was either a gift from the powerful human mind or a lucky draw from the hidden chemistry of the living world. But the search for relief often turned to a method that left its own visible signature on the skin. Across the ancient world, from the Silk Roads of China to the marble halls of Greece, healers practiced a therapy known as dry cupping. This is distinct from its more invasive cousin, wet cupping, where the skin was lanced to draw blood. Dry cupping was a gentler, though no less dramatic, intervention. A practitioner would take a rounded cup, often made of horn, bamboo, or glass, and introduce heat to its interior by briefly holding a flame inside. The heated cup was then swiftly placed, open side down, onto the patient's back, shoulders, or other areas of discomfort. As the air inside the cup cooled, it contracted, creating a powerful vacuum that pulled the skin and underlying tissue upward into the vessel. The skin would redden and swell within the cup's confines, and when it was removed minutes later, it left behind a distinctive, perfectly circular mark, a temporary bruise that could last for days. These marks were not seen as a side effect, but as the very proof of the treatment's success. From an ancient perspective, this powerful suction was believed to serve a vital cleansing function. According to humoral theory, many illnesses were caused by stagnant or corrupted bodily fluids, known as bad humors, that had settled deep in the muscles and joints. The cup's pull was thought to literally draw these harmful substances from the depths of the body up to the surface of the skin, where they could be harmlessly reabsorbed or dispersed. The visible discoloration was the evidence that the bad humors had been successfully extracted, a map of the healing process written directly on the patient's body. For someone suffering from chronic back pain or stiff shoulders, this explanation was logical and the ritual itself was tangible. They could feel the intense pull and later see the physical proof of the treatment's work. But what might have been the real mechanism behind any relief they experienced? Modern understanding suggests several plausible, physiological reasons why this ancient practice could have provided genuine, if temporary, benefit. First, the intense suction dramatically increases local blood flow to the area under the cup. This hyperemia brings a flood of oxygen and nutrients to tired, knotted muscles while helping to flush out metabolic waste products that can contribute to soreness. Second, the process creates what is known as a counter-irritant. The brain can only process a certain amount of sensory information at once. By creating a new, strong sensation of pressure and mild discomfort on the skin's surface, the cupping may effectively distract the nervous system from registering deeper, more chronic muscular pain. It essentially shouts over the ache. Finally, the entire ritual, from the application of heat to the dramatic suction and the resulting marks, represents a powerful sensory and psychological intervention. For the patient, it felt like something profound was being done, a physical force actively pulling the illness out. This strong belief and the focused attention on the body could significantly influence pain perception, promoting relaxation and a sense of relief. So while the ancient theory of balancing humors was not correct, the physical act of cupping likely did create real, measurable changes in circulation and nerve signaling. The distinctive circular marks were not badges of drawn-out corruption, but signs of a biological conversation, a deep tissue call to attention that could, for a time, quiet an older, more persistent voice of pain. Behind each unsettling practice lies a pattern of human logic, a method to the perceived madness. The ancient healer was not operating in a void of random cruelty, but within a consistent, pragmatic framework. Their world was one without microscopes or molecular biology, where illness was explained by imbalances in bodily fluids, the influence of spirits, or invisible sympathies between objects. Yet within this framework, they were sharp observers of cause and effect. They saw a problem and reached for a solution using the only tools and theories they had. The effectiveness of many macabre methods can be traced to three clear pathways: empirical observation, chemical intervention, and mechanical necessity. The first and perhaps most powerful driver was simple, relentless observation. A healer did not need to understand germ theory to see that a wound packed with honey healed cleaner than one left exposed. They did not need a biology degree to notice that maggots, over time, left healthy pink flesh where only black decay had been. These were undeniable, repeatable results. The reasoning behind why it worked might be framed as drawing out bad humors or cleansing with a pure substance, but the action was rooted in a raw, empirical truth. If a treatment produced a visible improvement, it was validated regardless of how strange or off-putting the method seemed. This trial and error, passed down through generations, built a body of practical knowledge that often hit upon a genuine biological mechanism, even if the explanation was completely wrong. The second pathway was the accidental harnessing of chemistry. Ancient practitioners were masterful, if unknowing, biochemists. They experimented with every substance nature provided, from animal and mineral to human and plant. When they applied stale urine to a wound, they were deploying ammonia. When they placed silver foil on a burn, they were leveraging the oligodynamic effect. When they prescribed sugar of lead for diarrhea, they were using a potent astringent. They identified materials that produced a tangible change, drying a wound, calming a cough, or numbing a pain. The substance's power was real, its bioactive properties undeniable. The tragedy, as with lead or mercury, came from the long-term consequences they could not see, the slow poisoning that followed the immediate relief. But from their vantage point, the chemical worked. It solved the pressing problem right in front of them. Finally, there were the direct mechanical solutions to dire physical problems. This is where pragmatism became most stark. A building pressure inside the skull required a physical release, hence trepanation. A baby trapped in the womb after a loss required physical extraction, hence the post-mortem section. A severed artery bleeding a life away required an immediate physical seal, hence the cautery iron. These were interventions of brutal necessity, where the alternative was certain death or unendurable suffering. The theory might speak of releasing evil spirits or balancing vital forces, but the action was that of a mechanic, a plumber, or an engineer, addressing a catastrophic structural failure in the only way physically possible. Success was measured in the most fundamental terms. A life continued, a pain ceased. What unites these three pathways is a relentless focus on the observable outcome. Did the patient stop bleeding? Did the fever break? Did the wound begin to close? Within their pre-scientific world of humors and spirits, these healers were pragmatists. They worked with the materials at hand, guided by the evidence of their own eyes, and they were often willing to cross profound aesthetic or social boundaries to achieve a result. Their methods appear macabre to us because our science has given us cleaner, kinder, and more precise tools. But by judging them solely through that modern lens, we risk missing the profound ingenuity at play, the fierce determination to wrestle order from the chaos of sickness and injury, using every resource, no matter how strange, that the world made available. That relentless drive to find answers, no matter the cost, is the true legacy of these 25 practices. Looking back, it's clear that ancient medicine was never just one thing. It was a complex, often contradictory, blend of deep superstition, startlingly keen observation, and brutal, pragmatic necessity. To label these methods as merely macabre is to view them through a modern lens, with all the comfort and knowledge that implies. For the people who developed and underwent these treatments, they represented something far different, the absolute cutting edge of hope. They were the best available answers to the most terrifying questions a body can pose. When a loved one was fading from a fever or writhing in pain from a stone, the strangeness of the cure was irrelevant next to its potential to grant another sunrise, another breath. The healer reaching for the glowing iron or the jar of leeches was not a monster, but a problem solver armed with the limited, powerful tools of their era. They worked within a framework of beliefs we now see as flawed, yet their eyes were sharp. They noticed which substances changed a wound, which actions altered a pain. This empirical thread, the raw data of trial and horrific error, is what sometimes led them, blindly, to a principle that modern science would later validate. We see it in the antibiotic mold that might have lurked in mummy powder, the electrical stimulation of the torpedo fish, the microbial logic behind the fecal transplant. Their explanations were wrong, but their careful watching of results occasionally steered them right. This journey through history's medical mysteries ultimately underscores a timeless human constant: the profound, unyielding drive to alleviate suffering. It is a story of resilience, of communities and individuals facing the body's fragility with courage and creativity, using every resource from the earth, the animal kingdom, and even their own remains to fight back against the darkness of illness and injury. Their methods challenge our assumptions and expand our understanding of what healing has meant across the centuries. So we turn the question to you: which of these 25 practices surprised you the most? Was it the practical logic of the maggots, the tragic irony of the lead makeup, or the advanced thinking behind the transnasal brain surgery? Let us know in the comments below, and if you have another historical medical mystery you'd like us to explore, share that too.